Welcome to Insight, produced in partnership with WDSC WRPT in Duluth, Minnesota. Today we are chatting with Emily Edison, Executive Director of SOAR Careers. Emily has generously agreed to share some of her experience with us. Thank you, Emily, for joining us today.
Thank you for having me.
Talk about the work of SOAR Careers.
Sure. Well, our mission is to inspire personal transformation through career development. We help support people where they're at, and whatever their transformation looks like, we help work with them to get to that point.
And that's important, right? Where they're at, meeting people where they are. Mm-hmm. There's not a barrier to entry that requires people to go through hoops and figure things out and so on. You're going to actually help them through the process of providing a service to figure themselves out as well.
That's correct, and it could be anywhere from someone or an individual returning back from incarceration to someone who experienced a divorce or they're now taking care and have to have a job on their own, to someone who has just been out of the workforce and might need a little bit more assistance or help. So we help people navigate those systems and really focus on the individualized approach, because a job that I think might be good for you might not be what you want to do. And so we really work with the individual through assessments, learning style assessments, career assessments, communication style assessments. And through all of that and our workshops that we have, we really do a lot of one-on-one support with folks.
So it's men and women,
Yep.
People of different ages, people with different needs, people with different backgrounds. In terms of the number of people that you serve on an annual basis, how does that look?
We serve roughly 575 this past fiscal year, and that fluctuates. I started in 2012. And we had 800 folks that we were working with, and now we're down to 500, some plus. What we're seeing are people need a little bit more assistance to figure out where they want to go. And so we're seeing less numbers, but the need is increased in the individuals that we're working with.
So what you're not trying to do is to provide a stopgap job in order to drive up numbers or to talk about how many people you're serving. You've basically gone through a process in which you found that the type of services that you need to deliver have to have a longer span with more support. So why is that?
It takes a lot for an individual or any one of us to, if you're kind of swimming around and where you're gonna go, it takes a little bit to figure it out. Some people it might take a month because they know what they're going to do. They walk in, they just want a resume, they just want a cover letter, they found the job that they want. And some people might not know what that is. And so really we're doing a lot of self-reflection work. A lot of the issues that we're seeing too are when folks are living in poverty or they've dealt with experiences in the past that have not allowed them to get a job right away, you don't have self-confidence. And if you're going out to get a job, you need to sell yourself. And so those two are conflicting, right? So we do a lot of work with folks to, figure that out and do positive talk, self-affirmations. A lot of people don't realize that things they've done in the past or maybe they did at home are transferable skills that could be used out at a place of employment.
And also, some of the things that they might have done in the past might be bad habits that actually don't translate and could hurt their chances of finding a new role. Before you get into the actual job training piece, how do you deal with that piece so that somebody can come and present themselves in a way with some confidence and knowledge?
Well, it's all about looking at the different fields of work you're going into, because, and I always use this example because it's a very easy example. If you have facial tattoos, applying for a receptionist job at a law office might not work. It might not be a good fit.
Right.
But working at a tattoo parlor or maybe some place that would be more accepting of it. So really it's looking at There are limitations. There are going to be some barriers. If you don't know Spanish, but the job requires Spanish, that's a barrier. So you know you don't apply for those types of positions.
Right. If you have to deal with reading and your reading level is not where it needs to be.
Correct. Then we work with someone and we make referrals and say, hey, there's a really great adult basic education program in town. They could help you brush up on those skills. We know that you need to be at a 8th grade level if you want to enter into college or go into, so those, I mean, it's really dissecting once again the individual and just realizing and recognizing that wherever you came from in the past, honoring that, and that gives you a lot of skills that you might not even know that they're skills. You've viewed them as a deficit, but they might be more of a positive. And so working on that with folks to see that.
So you're coming to them as a consultant to help them navigate. They're doing the navigation. They're making all the decisions. But you're basically saying, okay, if you want to go in this direction, here are the barriers you might face.
Yep.
You're not saying you can't do it. You're just saying, facial tattoos might not work in a law office, or they might.
Yep.
Right? And if you need to brush up on language skills or whatever, you're providing that. What happens when you get to that point where I know that I want to work in a restaurant? How do you help me find a job now?
So it depends on, first we look at, do you have skills to do those types of jobs? And so if we look at waitressing or serving or in the service industry, you help the person understand what that job would entail.
Right.
So you're going to have to be on your feet. You will have to be personable. This is what is expected.
You have to deal with complaints.
You have to deal with complaints. And then we work with someone to say, this is what the job is going to entail. And then we really help you develop your resume at that point, and or cover letter, whatever they require. And then we practice with you doing mock interviews so that your nerves are down. You can speak about yourself. You can be proud about what your accomplishments are. And really a lot of what we do too is if you have an absence of work history, 2 to 3 years, whether it's because you were incarcerated or you were in a treatment facility, whatever that reason may be, we help you answer that question.
How do you answer that question? If I have been away, I've been away for assault and battery.
Yep.
And it becomes evident. How do you have me explain that in a way that could create some understanding?
Well, you take accountability for your past actions. And in that case, if you served time in the criminal justice system or incarcerated, you've done what you've needed to do to serve out your sentence, right? But it's about taking accountability for what you've done in the past. And so answering that straight up, yes, I do have that charge. The circumstances around that were when I was 21 years old and I did X, Y, and Z. And what I've done since then, though, is when I was incarcerated, I finished my GED, or I took training to do, get specialized in skills, and I really used that time to better myself. And now that I'm out, I'm also utilizing services that are helping me with my anger issues.
So it's
just
about
using that as an example.
It's about confronting truth.
Truth, yep.
But then sharing that truth, which is very intimidating.
Without oversharing.
Without oversharing. Well, exactly. Talk a little bit about oversharing. What does that look like when someone overshares?
When you get into too many details, because really it doesn't matter.
Right.
Right? And so if we're looking at someone who's committed a crime, that's the fact. A crime was committed. The person got sentenced, they served their time, and they've done what they've needed to do. Yep. And so there's no need to really go into any details like, I was in this really bad time in my life and I was hanging out with so-and-so and then this happened. That doesn't matter. It's about looking at your past, seeing what it is and what you've done or what has been done, and moving forward and making a plan.
Now, you also have a new program called the Transitional employment pilot project. Talk about that. It's just a pilot, so
It is just a pilot. Yep. So we collaborate closely with other partners in the community, other workforce partners, and in the past we had a project that was for Opportunity Youth, and it was called Opportunity Youth of Duluth. Opportunity Youth are ages 16 to 24 who might be involved in the criminal justice system, might be currently homeless, involved in foster care, disengaged from school. And so through our partner agency and our partnership, we developed a program, a career pathways program for this youth. And out of that, we saw that there was a gap in the services we were providing because we were looking at youth jumping too quickly from one project, one transitional employment project that was on site at a local agency making candles, a social entrepreneurial site, to getting a real job and jumping in. And we saw that there's a transition period. So we've been working with the hospitality industry, different hotels in the area, and travel and tourism is a huge industry up here. And through that, we are developing how we can provide a job coach while youth are getting working at a hotel on a probationary period. And then we work with the youth and the supervisor at the site to help address any issues that might come up.
So this basically helps to smooth the way to a full job, a full-time employment.
Correct, and a lot of it is the term soft skills.
Right.
So it's showing up on time, not being on a cell phone. When you're at work, you're at work. How do you communicate? Smiling. You're in a customer service. So if any of those things would come up, and we haven't started it yet, which is exciting, we're developing it, but if any of those things come up, it's not an immediate termination. It's wow, maybe they didn't know you needed to smile. Maybe
Yes.
this is a learning opportunity. And that's what we're finding is a lot of folks might not have just been taught.
Emily Edison, thank you so much for sharing the work of SOAR Careers, how you help people navigate their independence and their workforce journey. And thank you so much for your insights.
Thank you.
Welcome to Insight, produced in partnership with WDSC and WRPT in Duluth, Minnesota. Today we are chatting with Jim Christmas, President and CEO of North Homes Children and Family Services. Jim has generously agreed to share some of his experience with us. I'd like to thank you for joining us today, Jim.
You're quite welcome, Mark.
Talk about how you founded this organization and the need that you saw back in 1991.
Well, just prior to founding North Homes Children and Family Services, I worked for Itasca County up here in northern Minnesota as a child protection worker. So I was charged, as many were, with investigating child abuse, neglect, maltreatment, incorrigibility of children from their families. And through the course of that work, I saw tremendous gaps in service, particularly in rural areas. Kids were being shipped far away from home for foster care, residential treatment, and other services that they needed, far away from their families and their local resources. So our mission right out of the gate in 1990 was to set up a care continuum in Itasca County initially, in Grand Rapids, to treat kids and catch kids where they're at and provide more local options for them when they're experiencing difficulties with behavior and mental health and delinquency.
And it's important for people to understand the daily life of a caseworker. You get a call, you get an assignment. Mm-hmm. Frequently the calls are coming in from some other operating unit, and you go out with very scant information. Talk about what you encounter as you come in with perhaps a one sheet of paper summary. There was some call, some report, some issue, and then you go out, and what do you actually encounter?
Well, it's all over the board, Mark, as you can well imagine. Initially, you're screening. So you're making some preliminary judgments regarding risk.
Right.
And that can be tricky and not exactly sometimes an exact science. But you make your best judgment and work as a team and screen those concerns that may come in regarding child welfare. And then off you go. And sometimes it's with law enforcement to assess the situation, to visit with the family if it's a neglect concern regarding, say, a youngster not coming to school adequately clothed or hungry, or maybe there's a maltreatment concern regarding some potential physical abuse, sexual abuse. You go in with those eyes and you make some adjustments and you err on the side of caution in terms of protecting the child. That being said, you're always cognizant of making sure and realizing that that family, more often than not, is that child's most important resource. So therein lies the challenge.
How do you go through that transformation from the initial, or that process of the initial notice, all the way through the experience and then through to a decision? And how do you train people today, with reference to your own personal experience and the experience of others, to make sure that those decisions and those acts are always as close to the interest of the child as humanly possible?
Over the years, and it's been 30 years since I've been a child protection worker, but I certainly work, and our organization works closely with Child Protective Services. So in terms of what their exact trainings are right now, I know that they've greatly improved. And it's a triage from a standpoint of, is there imminent risk right now in terms of what would necessitate an immediate child removal? And that could be and should be a temporary, and that is ultimately determined by the courts. If there is a need for out-of-home care, alternative placement, termination of parental rights, those types of serious interventions. But it is a team, and it is a careful process that is never taken lightly. And it can range from a single mom who's struggling to manage the store, who makes ends meet, lacks some of the parenting skills, and then it's a matter of, hey, how can we help you do this? Right. And that can be plugging in, and it's one of the service elements that North Homes offers, is in-home counseling services and parenting skill development and child supports in the home, in the family. So that's one of the less restrictive. And then off you go from there. And typically, if it's a child removal, it happens through the court system.
And how many people do you serve on an annual basis?
We serve about, over our continuum, which has grown significantly over these years, about 3,200 children.
3,200 children.
A year.
And this is a people-intensive business. How many staff do you have?
We have about 325 FTEs, and that doesn't include our foster care providers, which is about another 125.
So full-time equivalent about 330 and about 125 foster care providers as well.
Correct.
And in terms of the entire ecosystem there, you're functioning in an environment where you're interacting with state actors, yep. You're interacting with private citizens, yep. You're interacting with family members. Very often the family member ends up becoming the care provider for the child as well.
Correct.
And often when there is a resolution, it doesn't go into a foster care situation, but there is still some caring arrangement that is developed,
right.
in part through your negotiation intercession.
And it's really centered to our mission. Treating children in the context of family and community is core to our mission. So we, again, really strongly believe, even though it doesn't look real great on the surface sometimes with a family, that family is the child's best shot, typically, not always.
How do you ensure that you are capable of dealing with the cultural issues and the different problems that you confront? How do you recruit people to ensure that you have the cultural competencies to serve this very diverse community here and around in Minnesota?
Our primary minority group that we work with are Native American. We work with about, in terms of our total client population, roughly 20% Native. And we work extremely hard with the tribes, Red Lake, White Earth, Leech Lake, Fond du Lac, Mille Lacs, in trying to provide as culturally competent of a staffing component and cultural options for them to have in terms of foster care, in terms of the counseling approach, in terms of the cultural sensitivity that is unique to all cultures. That said, you don't bat 1,000.
Right.
You know, it's a work in progress, and it probably always will be, to make sure that we're doing the work as culturally competent as possible.
In terms of the services that you provide, let's start breaking them down by categories of service. I mean, there is foster care, which is a big component of what you do, but talk about the whole range of different services and also the range of children need, of children and family need that you actually address, even if you don't provide the services yourself.
Sure. So starting with foster care, as I mentioned, we have about 125, I believe, foster families who are trained specific to take care of children with complex mental health issues, child welfare issues. So some of those foster placements are short-term, emergency-based. Some of them are longer-term care for kids who have more long-term needs. And then along with foster care is adoption. And we offer adoptive services for Minnesota Waiting Children. I'm super proud to report that we facilitated approximately 40 permanency placements for Minnesota Waiting Children last year. Puts us up in sort of the forefront of the leaders in the state. And that really strikes to our mission's end game in terms of providing permanency for kids who otherwise are bouncing around the system, sometimes unnecessarily. And sort of backing down from that a little bit in terms of less restrictive, outpatient services, we offer that in-home program that I talked about in terms of working with families to keep kids at home or to help them in reunification. And we also have actually 3 outpatient mental health clinics in Grand Rapids, Bemidji, and then here in Duluth as well.
And mental health frequently deals with multiply diagnosed conditions. There can be certainly issues of addiction. Yep. There can be issues of attention deficit. There can be issues of behavioral issues, anger management, those kinds of issues.
Yep.
Yeah.
all
of the above, and,
yeah,
and much
then
more.
And much more. Yeah. So it's basically a community counseling center.
Right.
And again, we have 3 locations for those with therapists. And then out of those outpatient clinics is our school-based mental health program, which has grown tremendously and for really important reasons. We have mental health practitioners and professionals in about 32 schools up here in the Northland.
So you have very strong relationships with the school systems and with health providers, and of course with law enforcement and with state authorities as well.
We also provide residential treatment, and the Itascan Center in Grand Rapids, which is one of our initial programs, is a crisis stabilization unit it's 28 beds for kids who are in short-term, interim emergency care.
Right.
And that it can be all over the board in terms of why they might come through your door in that level. But typically, whatever's going on is in conjunction with some behavioral challenges that require 24/7 care. So we have 28 beds, and then we do an assessment unit in conjunction with that, figure out what's cooking and where the problems are and what kind of interventions can happen at that point. And then we have in that building a 13-bed intensive residential treatment program. Then right next door on our Grand Rapids campus, we have a 20-bed residential treatment cottage for serious emotionally disturbed children. And then in Bemidji, we have our outpatient mental health center. We also, here in Duluth and also in Itasca and Beltrami counties, work with the Safe Harbor program for sexually exploited young ladies, both in the case management side of things and doing skills work with them. And then we also have a safe house in Bemidji for young ladies who have been sexually exploited.
Well, thank you, Jim Christmas, President and CEO of North Homes Children and Family Services, for your work on behalf of children and families. And thank you so much for your insights.
Thank you, Mark. Pleasure being here.